South Africa reportedly has a significant burden of mental health issues, which contributes to the soaring rate of suicide. At only 13, this young boy has had the worst experience of his life. Coming back from school over a week ago, he found his 23-year-old brother hanging in their home. His mother says the stress of economic hardship took a heavy toll on his mental health.
He did his matric in 2022, and after matric, he applied at the Defence Force.
And then, unfortunately,
he did not get the job, and he tried school. Even there, he wasn't lucky. He wanted to do law. He told me that I was struggling. I decided to take crystal, but he said when I smoked crystal, it made me sick, unlike the other kids.
Sidumo says her family is devastated.
He hanged himself in the house. He was found by his sibling when he came back from school. So we tried to help him, and he also asked the neighbor to help his brother. When they got here, they teared the rope and he fell. But it was too late then. He couldn't help him.
The squalor conditions here explain the community's struggles.
The stress that they're having on a daily basis is this thing of unemployment. Once if maybe there can be a job opportunity from somewhere, from government or from any municipality that can come from this area, that can come, you can cater to them. At least some of the things they are going to be decreased. Some of those mental illnesses, mental health, depression, and this thing, the issue of committing suicide is going to go down.
According to the South African Depression and Anxiety Group, 10% of all unnatural deaths in adults and 9.5% in youth are because of suicide. But the problem cuts across populations. Petuleyabo Pelo, a non-governmental organization, says there's a need for better mental health services and greater awareness.
The minute you say to someone, I am stressed, I am depressed, I need help, people are quick to say, you are joking, you are playing. Why don't you just snap out of it, and live out of it? And it's not as easy as it's been said. When you're going through an emotional crisis, remember this, we're talking now a wound which you cannot physically take care of, but you need spiritual awakening, you need psychological, endowment, you even need psychological support so that you live out of it. So the minute you don't bleed physically, people don't think you are sick. And that's one of the biggest tricks that really lead people who are affected psychologically to end up taking their own lives, because of they don't get the right attention at the right time when they need it.
Sokeza says too many still struggle in silence due to stigma and discrimination. And while struggling to grapple with their loss, the Sidimo family will be heading to the Eastern Cape for the burial of their child this weekend. Mulimo Onemoto, SABC News, Pretoria.